everyone, I chose stress management in parental caregivers to children with autism spectrum disorder. With autism spectrum disorder, that they're typically diagnosed early in life around the ages of 18 months to 4 years old. And with autism spectrum disorder, the signs that you may experience or notice within the child are behavioral issues, poor social skills, speech and communication issues. And when you look at speech and communication issues, that can be things like being able to speak to other people. They may be nonverbal, or they may not be able to understand, people's tones of voice or sarcasm or jokes. And then when you look at poor social skills, people often typically think, poor eye contact. They can't maintain eye contact. Well, it may be true for most autistic people. Poor social skills also come down to like the inability to be able to properly communicate with people. They might not follow the social cues as easy as you do. So, that can really affect the way that they talk with people. And then there's behavioral issues. So some people with autism spectrum disorder may be huge sensory seekers, or they struggle with the ability to communicate with people, and that can be very frustrating, as well as the inability to like regulate their own emotions. And sometimes that can lead to emotional outbursts for the autistic person. So now that we kind of talked a little bit about the signs of autism and some things that they may experience themselves, I think it's great to shift our point of view to the parents who have now become the parental caregiver to a child with autism. Unfortunately, for parents who have children with autism, 80% of them experience incredibly high levels of stress compared to families who don't have children with neurodevelopment disorders. And this can really lead to some negative coping strategies for the parents, like drug abuse or alcohol abuse. Really, the stress for parents come before the diagnosis. You're going to start noticing signs and symptoms in your child, and you're going to want to go see your family doctor. Well, unfortunately, not all family doctors are able to diagnose autism spectrum disorder based off the DSM-5. So you may need to seek an alternative doctor, like a psychiatrist or a pediatrician who's able to do that. And sometimes you can be waiting up to a year to get that initial appointment. And in that time frame, like, you're without support and without the guidance of a medical practitioner. So once you have that doctor, I think it's great and very vital for the parents to have that access to a knowledgeable doctor who can help guide them in the right directions and, tell them what types of supports they may need. So some types of supports they may need may be occupational therapy, which can focus on fine motor skills. They may need to teach a child how to eat properly, because some autistic people experience safe foods, which can be soft. Some children may really lean towards yogurt, and with yogurt, you don't need to do much chewing. So they may need to teach your child how to chew. They may need to teach your child some fine motor skills, as well as, they might need speech therapy. Some autistic children need early intervention to help them with speech. And some things they might actually use in therapy are social stories. So like some social stories that they may show children are like playing at recess. It'll kind of go over like what to expect in those types of situations. Or they may have some social stories about friendships, and they will provide these to the children to help them through their day-to-day life. The last thing that is vital for families, for parental caregivers to children with autism spectrum disorder, I think, is accessing proper supports. Not only therapies, I think it's vital for parents to access those supports within the community, such as local groups for parents with children with autism, so that way you're able to relate to other people who are going through the same things, so you're not alone. This can be a great way for parents to decompress, as well as, kind of let some of their feelings out and reduce the loads of stress, because they might be able to, you know, get some advice from other parents who are going through the exact same things. Or parents might have, you know, different supports that they might be able to offer, or therapies they've tried with their children. So it's really, really important for the caregivers of children with autism to have low levels of stress. And some of the ways that they can do that is by having a knowledgeable medical practitioner and, you know, accessing supports throughout the community, whether that's through therapy or local groups. Thank you.